Good morning, Russell Peter. I am Mihiraa. Let's start the warm-up sessions. What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients. You can now start your OET roleplay. Good morning, Mihiraa. How are you feeling today?
I'm a bit nervous, to be honest. The surgery is tomorrow, right?
Yes, it is. Don't worry, you're in good hands. Mihiraa, today, I'm here to talk to you about patient-controlled analgesia, or PCA, which you'll be using after your knee replacement surgery. Well, do you know what PCA is?
I've heard of it, but I'm not really sure how it works.
No problem, Mihiraa. Let me explain everything in detail. PCA, or patient-controlled analgesia, is a wonderful method designed to help you manage your pain relief after surgery. It allows you to control your own pain medication, which means you can get relief exactly when you need it, without having to wait for a nurse. The PCA pump is connected to your foreline, so the pain medication will be delivered directly into your bloodstream. This system is designed to give you control and comfort during your recovery.
That sounds good. But how exactly do I use it?
Using the PCA pump is very straightforward, Mihiraa, and I want you to feel confident about it. The pump has a button that you simply press when you feel pain. Once you press the button, it will deliver a preset dose of medication, giving you almost instant relief. This way, you won't have to wait for a nurse to administer your pain medication. I hope you find it easy. Do you have any concerns or questions?
That's simple and quick to understand. But nurse, I'm a bit worried about accidentally overdosing. If I press the button repeatedly, won't that happen?
I understand your concern, Mihiraa, and it's completely normal to feel that way. Let me reassure you that the PCA pump is designed with your safety in mind. The dose is carefully set by our medical professionals, and there's a feature called a lockout time that prevents the pump from delivering another dose immediately after the first one. This means that even if you press the button repeatedly, you won't receive more medication than what is safely prescribed. The PCA system allows you to self-administer your pain relief, which helps you avoid waiting time for a nurse to come and assist you. You will receive the same pain medication that you would if a nurse were administering it, but with the added benefit of being in control of your own comfort. If you have any more questions or need further reassurance, please don't hesitate to ask. We're here to support you every step of the way.
That's reassuring. What about side effects?
It's great to hear that you're feeling reassured, Mihiraa. Regarding side effects, some patients do experience mild reactions such as nausea, itching, or dizziness. These are common and typically not a cause for concern. The important thing to remember is that these side effects are easily manageable. Our medical team is always here to ensure that any side effects you experience are promptly addressed and managed effectively. Your comfort and well-being are our top priorities, so please don't hesitate to communicate any concerns you have during your recovery.
Okay, that makes me feel a bit better. Thank you for explaining it to me.
You're welcome, Mihiraa. Let's review our conversation to ensure you have all the information you need. We discussed patient-controlled analgesia, PCA, which you'll be using after your knee replacement surgery. I explained that PCA allows you to manage your own pain relief by pressing a button on the PCA pump, which is connected to your foreline. This delivers a preset dose of medication directly into your bloodstream, giving you near-instant relief without waiting for a nurse. You expressed concern about accidentally overdosing, but I reassured you that the PCA pump has a safety feature called lockout time to prevent this from happening. Additionally, we talked about potential side effects like nausea, itching, or dizziness, and I emphasized that these are typically mild and easily manageable by our medical team. Your comfort and well-being are our top priorities, and we are here to support you throughout your recovery. Please feel free to ask any further questions or voice any concerns you might have.
I will. Thank you, Russell.